Okay, I'm back again, and I was going to talk about this topic that everybody, several people, I think it was LessOfSarah and TheCurvyJones. They both kind of were, apparently this was a question that came up in a forum, and they were both a little bit heated up about it because some of the comments were really kind of flippant, like they were throwing around food addiction like it was, you know, not taking it real seriously, and it's a pretty serious topic. So the question was about, are all weight loss surgery patients food addicts? Can they, because I think there's an assumption out there in the general public that, well, of course they are, because how could you not be a food addict if you get 100 plus, 200, whatever, overweight? Of course you're addicted to food. Well, first of all, let me start with the whole idea of food addict. To me, that's always been kind of a funky term in general, because we're all addicted to food because we can't live without it. So compared to other addictions out there, to alcohol or cigarettes or drugs or whatever, you can cut those completely out of your life. You can't cut food out of your life. So that's where the line gets so mushy, is what's a food addiction and what is just, we got to eat to live. And then there was discussion that, Sarah was talking about the like medical terms that define food addiction, and as she described it in the list, I pretty much don't fall in the true. I think I've discovered I don't fall in the true food addiction line, in the in the true sense of the word. I fall in the overeating category. I was a snacker. I never was one to eat a huge amount at any one time. But I was one to kind of nibble and snack, and definitely I think there is a physical, there can be a physical addiction almost to sugars and like refined carbs. And I think I was somebody that just, I was definitely kind of addicted to sugar, if you want to look at that as a food addiction. But I think the thing that I wanted to talk about the most about this topic that has to do with just my experience is when I went into this, pre-op, I was convinced I was a food addict or a compulsive eater, or whatever you want to term it. I was convinced I was a food addict, and that food addiction or compulsive eating, overeating, was the reason I was obese. That was the only reason, or the main huge reason why I was obese. As I've gone through this now, almost in a week it'll be like 9 months out, I'm realizing that a food addiction or compulsiveness to food, the food actually plays a small part. I had a bad relationship with food as far as picking the wrong things, and definitely was like carb addict, that kind of a thing. But I think what I've discovered as this whole journey has unfolded is that there's a lot of medical and physical issues that I have and had that contribute to my obesity, and that those are actually more to blame than any of my bad eating habits. Because like my sleep apnea for one, I was convinced, because everybody else that talked about sleep apnea said within the first 6 months you're off your CPAP and your sleep apnea is gone. Mine's not. So now it might still improve because I carry a lot here, and just like your skin, like my skin on my chin and my neck is all sags. At first it sags more, and then it will recover some. I'm wondering if my throat still has to recover. That's what Dr. Metz was saying. That, it might just take time for the skin in the back of my throat to pull up. But I have a feeling that for me, the sleep apnea, I need to get my weight down at least to normal weight. So I've got to get down probably another 20 pounds, really, before I hit where that sleep apnea might, if weight is the reason I have that sleep apnea, it started before I hit 150. Because I know when my husband and I when I was first married, my husband's like, I never snored. I never made a sound until I got pregnant with my son, which was, he'll be 21 in August. So, that would have been 20 years ago when I got pregnant with him. And it started at that point. So there was one shift. So that's one shift. There's so many factors involved with what makes us obese that it's hard to break it down. Now, after this journey where food becomes such a focus of this journey, I've been able to break down what more parts. So step one, when I got pregnant, I was about 150 when I got pregnant, and that first time. And that's when the one shift started that made me start snoring, and I think that's when my sleep apnea started. And sleep apnea is one of those things that builds on itself. As you get a little heavier, which you do when you're pregnant, I didn't gain that much with him. I gained maybe 25 pounds with him and lost it fairly easily. But I think that sleep apnea remained this much at that point. And then as it remains, it builds on itself. And when you're not getting enough oxygen at night, it makes your body shift. And that shifts your metabolism a little. That can mess with your brain chemistry. So I think all the stuff that's been tied into a lot of things is it created a bad environment for my brain chemistry and for my metabolism. And over the years, it just got harder. It was like ever so slightly every year. I gained the weight, sleep apnea got a little bit worse, depression got a little bit worse. All this stuff sort of built on itself over the years. And then when I was, let's see, I don't know, when Evan was probably about 4 or 5, probably more like 5. For sure, yeah, because Haley was a baby at that point. So that's when I started medications for depression, because my depression got bad enough. My weight went up a little bit. It was probably 160s at that point. My depression got worse. My sleep apnea was worse. I didn't know the sleep apnea was in there. I didn't even know that was a factor. So the depression kind of built on itself, and I went on medications. Well, the medications, one of the side effects, they may help your depression, but one of the side effects is the ones that I started on slowed my metabolism down. So hence, that's when I jumped up into the 180s. And over time, going off and on medications and various medications, it seems like it didn't matter if I was going off or on a medication. Every time I shifted a medication, my weight would jump 10 pounds. And that added to it. And then you get to a point, I think, that all of us can probably relate to, where you just stop looking. I don't think it was because I sat there and ate a ton of food and binged on food. I snacked a lot. I used emotionally. I am still an emotional eater. Food is definitely something I turn to for comfort. But I don't turn to huge amounts. I don't know if that makes me a food addict or not. I don't know exactly. But I think I'm discovering that as far as my obesity is concerned, I don't know that the bad eating habits have as much to play as all this other stuff. That basically I ended up with a metabolic disorder, and then I just stopped caring. I stopped because it just seemed like nothing I did made a difference. So I stopped looking in the mirror. I stopped weighing myself. And that's like the kiss of death, because you go up and up and up and up and up and up and up. And then it just kind of snowballs on itself. You feel bad about yourself and all that stuff happens. So, that's sort of my take on it. It's kind of been a surprise to me that I think I basically my body had gotten into a place where it was just kind of irreversibly at that point, my metabolism was just screwed up. So I think I had like what they call metabolic disorder of some kind. And this surgery turned it around. This surgery has shifted my whole metabolism around. Because I don't know, yes, I eat less than I did. But at this point, most days I'm getting like 1,200 calories still. And I know I went through periods where I was, watching calories, but I was aiming for like 1,800 calories, and that was really hard to do. So I think that little bit less of calories, being able to go down. But I don't know that I was ever somebody that ate a huge amount. I just had such a slow metabolism that it didn't take much. It might say my metabolic rate is at 2,000 calories a day, but eating 1,500 to 1,800 calories a day, I didn't lose weight. Now eating 1,200 calories a day, I lose weight. Now this weekend I was more like 1,000 calories. So my body needs to not eat as many calories in order to probably maintain this weight. I'm guessing 1,200 calories is basically where I'm going to maintain eventually down the road. We'll see. But my metabolism got really screwed up. And I think that's where my obesity came from. So this has been an interesting topic in tracing back what is the cause of your obesity, because I think it's really important that we all do that. we have to sit and really look at how did we get obese, because we don't want to go back there again. So all of the factors matter. Not any one factor. You can fix any one factor and you're not going to be able to fix the problem. You can fix your food addiction, but if you don't have your body's metabolism and health lined up, you're fighting a losing battle. Your body's not going to work with you. It's going to work against you. So you have to work with the whole picture and work with your food issues, your metabolism issues, your health issues, and all of those working together is what gets the momentum going the right way rather than the wrong way. So that's my take on this topic. I found it interesting, and I don't believe all weight loss surgery patients are food addicts. I think a food addict needs to be taken more seriously. I think it's one of those things that's more of an extreme, like she said, 5,000 plus calories in one sitting. So really stop and think before you call yourself a food addict. Because first of all, why be hard on yourself if you're not there? Own it if it's yours. Own it if it's yours. And if you are a food addict, you definitely need to get underneath that addiction, because weight loss surgery is not going to fix the addiction. It might help your metabolic issues, not going to help up here. I think it does shift some brain chemistry, so I think there is sort of because of the kind of a trickle-down effect of all the other things that change in your body, that it can't help but change your brain chemistry, especially if you're somebody like me that's kind of has a sensitive brain chemistry. But I think it's not going to have your mind plays such a huge role in it, that if you can't control the food addiction, there's ways around it. There's always ways around it. So you have to face all the different factors, and sometimes it's just as scary to face the physical problems as it is to face the mental ones. Some people have an easier time going to therapy and trying to work on that than they do stopping and stepping back and saying, wait a minute, I don't need to blame myself for everything. Because I think I grew up blaming myself for everything. Everything was my fault. If something went wrong, I did something wrong. And I took all of it, rather than like in this situation, it's not about taking all of it as my poor behavior. Some of it is just the genetics I was born with. There's other factors. There's so many factors involved. So that's my take on it. I thought it was an interesting topic. Chime in. I think it's something that's interesting. I'd be curious to hear from people who do feel like they're true, what do you call it, clinical? I think that's the word I would use. True clinical food addicts, that you would be termed a clinical food addict. What is your take? Because I think that the general public feels like everybody's a food addict, but I don't think that's true. But even if it is it the food addicts that have the hardest time, regardless, getting that weight off? So chime in. Talk to you later. Thanks. Bye.